Hello viewers, so today we bring you another topic, an area of interest that I have particularly been asked about time and again when I go out to engage with different communities, and it is a strategy that many have been using for weight management. And people usually ask, what is intermittent fasting? People ask, will intermittent fasting work for me? Does it work? Does it give results? And what does it mean? So intermittent fasting is a routine or a way of eating. You determine a window in which you can eat and a window in which you can fast. So it stems from the term fasting because you have hours of fasting and you have hours of feeding. So usually we look at a ratio or a window, and the ratio might be, for instance, 12 to 12. 12 to 12 means that for 12 hours you're fasting, and for another 12 hours, that's the window in which you're allowed to eat. And this goes to say that even when you are in the window for eating, it is important that you actually feed on the right foods with the right nutrients and food values that you need, not eating processed foods or over-processed foods or junk food, because this will still hamper the results that you would want to get. During this time, however, you are encouraged to continue hydrating, especially with clear fluids. That could be water, tea, juice. If you are able to do a total fast within these hours, it's even better. But remember that the body needs to stay hydrated. We encourage a good diet, which is usually a diet high in protein, fruit and vegetables, calorie-dense diet, and less of the carbohydrate. So intermittent fasting does work, but it needs to be added onto other lifestyle strategies like exercise. We recommend at least 150 minutes a week. That's about 30 minutes per day for 5 days, with 2 rest days. Another way people do intermittent fasting could be alternate day fasting. If I fast today, then tomorrow I can take a break. Others do even a 5 to 2, meaning for 5 days they're practicing intermittent fasting or fasting, and then for 2 days they can eat regularly but not carelessly as well. What are the benefits of intermittent fasting? They include weight management or weight loss. They include improved insulin sensitivity, so it helps people manage their sugar better. However, we do not encourage newly diagnosed diabetics, those with high blood sugar, or those who have advanced diabetes to actually use intermittent fasting. We also discourage pregnant women from using intermittent fasting, and people who have other conditions where they have to swallow drugs that lower the blood sugar. It also helps to improve cardiovascular health because we are able to reduce things like lipids. It helps to improve overall well-being of an individual. It helps to improve one's lifestyle. Other benefits of intermittent fasting include improved immunity, improved heart health, improved brain health, improved cognition. All these are results that we have seen as a result of intermittent fasting. It also promotes repair and healing, replacing of old cells with new cells, so the body is able to repair itself faster, and that helps with the immunity also picking up. So it is a strategy that we recommend for those looking to live a healthier lifestyle, those with looking at losing weight or managing weight, because as we've said before, weight has been linked to many of the non-communicable diseases. So a strategy of preventing or fighting non-communicable diseases is using some of these strategies like intermittent fasting. Just to expound a little more on what happens while you're intermittent fasting, one thing is your appetite will reduce because your body will adapt to a particular routine or window in which you eat. And during this time, the body is actually going to divert and use other calories that you've stored, like fat and ketones. So the body will resort to using this, and this helps you to lose weight. and burn those excess calories. Intermittent fasting can be done. It's good for you and me as long as you don't have the conditions that I mentioned earlier. It also helps turn on your metabolic switch, and once your metabolism is high, you're able to expend more energy, burn more calories, excess calories that you have previously stored away and yet you do not require them. So let's take on this strategy for those that qualify. It does work. For those who have been asking, does it work? It does work, and it is something that can be sustained for the rest of your life.